what did you find in the infection and how it has to be treated when you have Lyme disease in your mouth?
Okay, what we see is that there's a huge influence of Lyme with infections in the teeth and the jaws. You know, if you can't do out or put out infected teeth, infected areas of the jaws, Lyme, you are not as successful in treating Lyme as you were if you do it.
And you found that it is behind the wisdom tooth?
There. Perhaps I can tell you some very usual locations of infection. Those are dead teeth, especially root-filled teeth. There are regions where teeth were in before, they were extracted, and there's still infection inside the jaw. I saw cases 20 years after extraction of a tooth, there was still infection in the jaws. Wisdom teeth make problems, we know that as a dental stove. It's an old thing, it's nothing new. And a special case in these things is the region behind the wisdom tooth. It's described in the literature as NICO, N-I-C-O. Means neuralgia inducing cavitational osteitis. We just switch a little bit the name because we call it DMS, distal-molar systematic disease. That means a lot of people, they have infections behind the wisdom teeth, behind the tooth number 8 inside the jaw, and they don't know it because they have no neuralgia. They don't have problems, no pain, but it's still inside there. We have 2 genes. One gene produces the bone of the skull and the jaws, and one gene produces teeth. But we don't need the tooth. The tooth is not produced anymore, but produced is the location inside the bone where the tooth will be. And this is obviously a weak region in the jaws, and infection go inside in this region and makes problems. It's not so easy as we think. A normal X-ray, what we call orthopantomogram, doesn't show in all cases those infections because they are not, the solution of those things is not high enough, and we have to use a special dental CT where we can see that more clearly and more efficiently, and then we can say, okay, we have this region 9, or we have problems at a root-filled tooth, and so on. And what is very necessary in diagnosing such processes is to combine the picture and the problem of the patient and the examination of the patient, because only those 3 things make sense to make a diagnosis. It's not only the picture. The treatment, I must say, the treatment is surgically. The treatment is not with antibiotics in this region. Surely it might be necessary for treating the general infection like Lyme, but it's locally the treatment is surgically. That means removing the infected bone, removing the destroyed bone. And in this region 9 we see very often the fatty degeneration. It's a special kind of infection of the bone, and to remove this. And what is also very necessary in treatment is to treat this open. That means you created after surgery a little hole where the infection is, and this hole must be cleaned for several weeks.
Wow.
Because I say the bacteria, they hate air, and they don't want light, and it has to be open, that it can grow very slowly from the deep till the hole is closed.
Wow.
By nature. It's not only pulling out a tooth or just cleaning the bone. The treatment afterwards is as necessary as the surgery itself.
Wow.
Yeah, this is
So
very
the surgery is part of the treatment, and
Yeah.
keeping it open is part of the treatment.
This is the main thing. Yeah. The
Is
main
it
thing.
painful to treat?
No,
For the
no,
patient?
normally not. I got it from my own. It's not painful. I promise you, because it's not a very aggressive surgery. It's
Okay.
just a local small surgery. This makes it very gentle for the patient.
Do they recover from the Lyme disease?
Yeah, a lot of systems disappear. What typical is the shoulder pain, or the hip pain, or the knee problem.
Go away.
They are away afterwards if it's the right diagnosis. Yeah. But if you have a process at, let's say, at the right side in the upper jaw, there is a small test. There's a small test. It's well known since the 40s of the last century. It's the test after Hunecke. You just inject some local anesthesia in this region. And before the patient couldn't move his shoulder, and after the small injection, 2 minutes later, he can move his shoulder very properly. And then you know there is something inside. And then you have to treat it. But if you only give antibiotics against Lyme, and you don't do that, your shoulder pain won't disappear, I'm sure.
How was your personal experience with Lyme disease?
And you know, I was in treatment. A friend of me, a rheumatologist, he treated me, and I had so many problems, skeletal problems. I didn't know where they came from, and he first treated me as a rheumatologic patient, and then I said, okay, I'm often in the forest, and perhaps it might be that this is Lyme. And then I saw my friend took books and read and said, okay, we test you. And then I was lucky that the antigen test, the normal ELISA test,
Yes.
showed that I had Lyme.
Wow.
But he didn't know anything about co-infections. He just treated me with Rocephin, with doxycycline. I took 4 weeks long.
It was not
Rocephin.
enough.
It didn't work because it doesn't work with chlamydia and doesn't work with mycoplasma in combination.
So you would say, and this is asking to the doctor, the lines that just say about Rocephin or doxycycline, they're wrong because they're not really looking to all the programs. How could you recover? With that guideline, you wouldn't recover.
I only can say that Armin Schwarzbach saved my life, because if he wouldn't have diagnosed those co-infections, I would have taken the wrong medicaments, and I wouldn't sit here in front of you and talk about Lyme and talk about those problems. I only can tell it for my life and for that what I experienced. And today I'm very happy and everything works well. But this is also I tell to my patients, you never got out of Lyme. You have Lyme for your whole life, and if the immune system goes down, it might be that there might be some symptoms again. Yeah, you can't be sure.